friends. Welcome to our YouTube channel for Psychiatry Education Forum Academy. I am Dr. Harvinder Singh.
I am Dr. Satinder Pal Kaur.
And we are the creator of Psychiatry Education Forum Academy. So the video that you will watch right now is a very short clip from one of the chapters of the Academy so that you can get an insight as to what we do in our Academy. So please watch it and we will see you at the end of this video lecture. The most recent one was published in 2021, and this is the consensus diagnostic criteria for apathy in neurocognitive disorders. The main goal behind the developing this 2021 criteria was to facilitate use of the criteria mainly among those with either mild or advanced cognitive deficit or physical impairment. So let's go over this criteria briefly now. So, I just mentioned it. So this was the goal behind this criteria. Now, criterion A is very, very different from the last two one. So what they focus on is that a patient meet criterias for a syndrome of cognitive impairment or dementia. So it has to be defined by DSM-5 or the ICD. And the examples are Alzheimer's dementia, vascular dementia, frontotemporal dementia, dementia with Lewy body, Parkinson dementia, or pre-dementia cognitive impairment syndrome like MCI, prodromal Alzheimer disease of other cognitive disorders. So these criteria for cognitive impairment or dementia has to meet first because this is more focused on the neurocognitive disorders, right? Number one. And before I go into the B and B criteria, let's do the C and D quickly. So C says it's not exclusively explained by anything else like psychiatric illness, intellectual disability, physical disability, motor disability, change in the consciousness level, or direct effect of substances or medications, I should say here as well. And D is that it causes significant impairment, clinically significant impairment in personal, social, occupational, or other areas of functioning. And this has to be a change from their usual behaviors, or I should call baseline. But let's see how the B is different. Now, for criterion B, a patient should exhibit at least one symptoms in two of the following three domains, like B1 to B3, like it was going on for last two criterias as well. And these symptoms have been persistent or frequently recurrent for a minimum of 4 weeks and represent a change from patient's usual behavior. And these may be either reported by patients themselves or observed by others. So I have not entered it, but you see how this was in criterion A before, right? But it's all there. They have not removed it, but they have focused more on criterion B because criterion A does not include that motivation like the one we saw in the 2008, or those goal directed reduction in behavior, cognition, emotions, or social domain that was mentioned in 2018. But all these domains are here now, and they call them dimensions now. So there are three dimensions, B1, B2, and B3 here. At least two of the three has to be present. So let's go with the dimension B1. Now, this is more focused on diminished initiative. So they have actually given examples here. So there is less spontaneous and or active than usual self, like they are less likely to initiate usual activities like hobbies, chores, self-care, conversation, work related or social activities. So the initiative is affected here. Oh, actually, yeah, these are the examples that I just mentioned here. You can see self-care and the conversation, social activities, hobbies, chores, they're less likely to initiate it. So the initiative part is dimension B1. And you can see they have actually compiled many things together here. So I think they want to make it more easy. So you focused on initiative, B1. Dimension B2 is more diminished interest. So a person is less enthusiastic about usual activities, like they're less interested in or less curious about events in their surroundings, in their environment. They're less interested in activities and plan made by others. They are less interested in friends and family. They have reduced participation in activities even when stimulated. They are less persistent in maintaining or completing tasks or activities. You see how these were all mentioned in 2018 criteria, but they have combined them here in the diminished interest section. And the third domain is B3, or I should say dimension. Here, a person have diminished emotional expression or responsiveness. So there is less spontaneous emotions. They are less affectionate compared to their usual self. They express less emotions in response to positive or negative events. And they are less concerned about impact of their action on other people, mainly around them. And they have less empathy. Again, we all talked about this before in 2008. It's all there, but they have combined them in different dimension. So again, I will summarize the three dimensions are: first is diminished initiative, second is diminished interest, and third is diminished emotional expression or responsiveness.
Thank you for watching this video. If you find it clinically relevant, please join our Academy membership.
And please note, this membership is only for medical professionals so that you all can stay clinically updated. Please go to psychiatryeducationforum.com to learn more. I hope we will see you there soon. You all take care and bye for now. Thank you.
Bye for now.